Why Medical Terminology is So Important by Christelle Crutchman. How medical terminology affects medical mistakes. Mistakes can be a tool to allow us to provide better care. Judy was 39 years old when she went to the hospital for a hysterectomy. After she died on the operating table, autopsy revealed that the anesthesiologist had placed the endotracheal tube in her esophagus, not her trachea. This mistake could have been because of lack of knowledge of the difference or any other number of reasons. Yes, this is a perfect example of how medical terminology is used to help us understand the body, diseases, locations, and to better provide care to our patients. You can see the difference here between the trachea and the larynx. One small mistake can make a big difference. You could give the wrong medication or just give the right medication the wrong way. It can be the difference between ordering the right test or the wrong one. In healthcare, using the wrong term or word can be harmful and even life-threatening in some cases. Common abbreviations are used in patient charts, which therefore anyone who works in healthcare, no matter frontline patient records, medical records, or nurses and doctors, should all have some knowledge of medical terminology. One thing about healthcare is that when you make an error, it can be life or death. But also in healthcare, you have to know to err is human. Knowing your worldview and values, along with the values and expectations of your organization, is important. Knowing how to deal with any mistakes and errors that may happen. In the healthcare world, the saying "to err is human" is associated with a well-known report that emphasizes that errors in healthcare are more often systemic rather than individual failings. But admitting that someone was hurt by a mistake that you made or a mistake that was made on your watch can still be personally daunting experience. This daunting experience can lead to many not reporting their errors for fear or shame or simply because they think no one knows. Knowing how you will personally handle an error if you're faced with one can be important to any person working in healthcare. Knowing your worldviews and the expectations of your organization can also be vital. When placed in the shoes of a nurse who made an error and what I would do, it forced me to be brutally honest with myself. If I knew my mistake wouldn't hurt someone or I wouldn't get caught, would I still be honest? My answer is yes, because of who I am, because of my worldview, and because of the organization I work for. Our organization has a culture of openness and honesty, and doing what is best for the patients always. I would report immediately to my supervisor. I would also fill out an electronic incident report that helps the organization track incidents to better help our staff and patients with providing quality care. Whoever walks in integrity walks securely, but he who makes his ways crooked will be found out. Proverbs 10:9, English Standard Version. During this course, we had the opportunity to interview someone who worked in healthcare. I chose to interview a coworker. While interviewing my coworker, who has been in healthcare longer than myself, I learned the following. Medical terminology is a must. Everyone who works in healthcare uses some form of medical terminology in their daily work. It will help prevent errors and mistakes on all fronts. 2, errors do happen, probably more often than any of us know. Knowing how to react when an error happens and finding reasons for the errors to prevent them in the future can help you work through them. Making yourself an asset to your company can involve many things. Being knowledgeable, dependable, making yourself an asset to those you serve, in this case the patient, and become part of the organization more than someone who just punches a time card. The only way to do great work is to love what you do. How will I make myself an asset to my organization? I plan to lead with honesty and integrity. Continuing education Never be afraid to ask for help or educate yourself in areas you need growth. Provide quality service to our patients. Become a servicing member of the organization and the community. Never be afraid to give suggestions or ideas that could help the patient, staff, or organization. I'm doing this currently by continuing my education in healthcare administration. I'm also doing this by serving on a service excellence committee that meets monthly to make sure that the organization is providing quality care to our patients. Below you can see my references to medscape.com. Healthcare professionals make mistakes, and that's okay. Retrieved from Scientific American, and also Avidity Medical Design blog. Thank you.